introduce our second speaker, who is Professor Isabella Aboderin. So she is Chair of Africa Research and Partnerships and the Director of the Paravoli Africa Research Centre. So Isabella sees PARC as a catalyst for rebalancing of research collaboration with Africa to support the continent's pursuit and achievement of its own development objectives. Her commitment to finding new partnership approaches that overcome inequities and drive action and change is anchored in her own extensive experience in navigating relationships between African and international institutions and in engaging policy actors as a knowledge partner. Isabella's research explores intergenerational linkages of and long-term care for older populations, their consideration in existing policy architectures, and their relevance to Africa's harnessing of its demographic transition. And with that, I'll pass over to Isabella.
Thank you very much, Susie, and thank you, Lauren. It's a pleasure to be here today and to share with you some reflections which in many ways dovetail really nicely with David's presentation just now on the implications and the impacts of the COVID crisis on poverty in older age or poverty and older populations in Africa. Share my screen. Here we go. Can you see it? Can you see the screen? Yes. Okay, so I think it's really important to place questions or thinking around the impacts and the implications that COVID has had on questions of poverty and older age in Africa within the context of the broader debate on aging and older populations in sub-Saharan Africa, and more specifically, the evidence and the perspectives and the discourse around old age poverty that was central to that debate pre-COVID. So I will start with that. I will start by sharing a few reflections on the thrusts of that debate as a context. I will then move to sharing what evidence there is, and there isn't much, about the impacts that the COVID crisis has wrought on older people in particular in the continent, and then end with some reflections on what implications might arise for both scientific and policy debates. So the debate on aging and older populations in sub-Saharan Africa is by now well established, many decades old, but it's expanding. It has been expanding in recent years as part of a global aging discourse. For the most part, the debate has been centered and has been based on a chronological definition of older age, which defines older people as aged 60 years and above. But it's important to note that there are persistent critical perspectives about the extent to which such a chronological definition is meaningful and really captures the essence of older age in the African continent. And more recently, there's been sort of a global perspective which argues the use of chronological age, but of prospective longevity, which rather measures the length of time left before one dies, combined with health status. So just to say that the definition around what is an older person is quite contested. Africa, of course, has a unique demography. It's the youngest region in the world, a youthful population with almost 2 in 3 aged below 25 years, and only 5% or so roughly at the moment aged over the age of 60. Of course, there's sub-regional differences, but overall, the proportion is very small. At the same time, it has an extraordinarily rapidly growing absolute number of older people. That number is growing more rapidly in Africa than elsewhere in the world. Within this context, I think it's fair to say that the debate on issues of aging and population in Africa has had a distinctive set of foci. On the one hand, and in contrast to high income and middle income countries whose population are already mature or are rapidly maturing, there's been relatively little concern with the impacts of aging on the sustainability of societal systems such as labor markets, economies, health and social care systems, or security systems. Rather, I think it's fair to say that the focus has been on ensuring well-being and the rights of older adults, obviously a rapidly growing number of older adults. And the debate in recent years has been underpinned by a reference to the Sustainable Development Goals, which explicitly include questions of older age in several of the goals, the WHO Global Strategy on Aging and Health, and an Africa-specific protocol, AU protocol on the rights of older persons in the continent. Within the debate, there have been two dominant narratives. The one sees older adults as particularly vulnerable to poverty, exclusion, and abuse. The other sees older people as making valuable contributions to development. These two are not mutually exclusive, but these are sort of the major strands of narratives about experiences of older age and older adults in the continent. The valuable contributions to development are anchored in the idea that older people are repositories of knowledge, are carers for young children, and I'm sure many of you will have a sense of the role that older adults have played or continue to play within the context of HIV/AIDS. More recently, there's been an emergence of more nuanced perspectives, or more critical perspectives, if you like, which highlight the need to foreground the heterogeneity and the inequalities within the older population. Whereas before there's been a tendency to talk about older people as if they're a homogeneous group, these perspectives highlight the importance of going beyond that to look at the patterns and inequalities within the older population. And they foreground the importance of understanding the multi-layered connections, both negative and positive, to youth and child-focused development agendas. So within this context, the discourse around poverty and later life, poverty and older age, has sort of centered on four key issues or perspectives. The first is a sense that later life poverty reflects both exposures in earlier phases of the life course, for example, lack of formal education, ill health, or inability to accumulate savings or assets because of the nature of the work that one was in. But it also reflects contemporary constraints at both macro and meso levels, lack of pension coverage, unemployment or poorly paid employment, limited healthcare access, limited family or intergenerational support. The second perspective or characteristic, I think, that sort of defines the discourse on older age poverty in Africa is that there has been a focus on some dimensions of poverty, in particular income poverty, where data evidence has looked at consumption and asset-based measures almost all of the time at the household level, has looked at food security, and has looked at disease burden and access to healthcare. But there hasn't been so far a systematic multidimensional approach to understanding later life poverty in the African context. The third perspective that has emerged quite strongly over recent years is the idea that age is an axis of poverty inequality within the continent. And this builds on evidence which shows, but I should say the evidence is not particularly strong yet, which shows that older adults compared to younger age adults are more likely to live in poor households, are less able to access required healthcare despite a greater disease burden. And this reflects both financial and physical barriers, as well as the unavailability of care. And that in turn reflects the orientation of health systems, which are rather geared to addressing disease and health needs of younger generations, reproductive, maternal, newborn and child health, infectious diseases, and a quite narrowly defined NCD agenda. The idea that age is an axis of poverty inequality and that older adults are more at risk of poverty has earned a growing debate over the last decade, I would say, and I should say expanding programming on old age social protection measures, in particular social pensions, social health insurance or fee exemptions. And this in turn has spawned a debate about the effectiveness and the impacts of these social protection measures. And then lastly, obviously questions have been raised about the inequalities in poverty within the older population. And here I think it's fair to say that there has been little focused examination, and the evidence that exists suggests that there are spatial, rural-urban inequalities in income poverty, with rural areas and older people living in rural households disadvantaged compared to their urban counterparts. The evidence also points to gender inequalities in disease burden, but when we get to healthcare access, the picture becomes much less clear. And the same is the case for income poverty. And whilst there is a general sense and a general debate around the feminization of poverty, there are also critical perspectives which argue we need to think more carefully about the social capital and other sources of support that older women might have compared to older men, which actually render them less vulnerable to poverty. But the evidence here is very sparse and remains an area for debate. So within this context, it's now important to ask what the impacts of the COVID crisis have been on older people in sub-Saharan Africa, and in particular on their poverty. And as I mentioned initially, the evidence that exists is still very sparse. There are a few rapid assessments that have been undertaken. So there is very little robust, let alone large-scale evidence and data to draw on. The first thing to say, of course, is that the COVID crisis really has acted for Africa, I would say, at the same time as it has globally, as a spotlight. You know, it has heightened awareness of the fact that older populations are there, has heightened awareness of vulnerabilities within this population. Specifically, the COVID crisis has raised and queries about the impacts of both the virus, but also the impacts of the mitigation measures taken on two key levels. The first, and I think this is also what David referred to in his talk, are concerns about the impact of the crisis on older people in terms of the risk of infection, disease, and death from the virus. And evidence that exists suggests that older people, just as is the case globally, have been at heightened risk of both the infection with the virus and then the serious disease and death that results from it. And the reasons for that, or the factors contributing to this greater vulnerability, are their higher prevalence of chronic diseases, often multimorbidities. They compromise capacity for against COVID, in particular lack of access to communication channels, a digital divide or exclusion, if you like, lack of access to telephones or other communication modes, a lack of access to water, sanitation and hygiene facilities, as well as care dependency, which makes social isolation and social distancing much more difficult. At the same time, there's been the lack of health systems responsiveness, which I've spoken about, as well as further constraints to healthcare access that have been exacerbated, if you like, by some of the mitigation measures. Restrictions on movement, as well as indications of ageist attitude and exclusionary attitudes on the part of health personnel. The second query or concern has arisen about the impacts of the COVID mitigation measures on social support, care and livelihoods amongst older adults. And here the limited and insights that we have point to the fact that older people, just like the population in general, has suffered a loss of employment, suffered disruptions to long-term care, material and social support from kin or from friends. And this in turn has reduced income, has reduced food security, has reduced access to healthcare for existing conditions, as well as heightened risk of neglect, abuse, isolation. And there are indications, not surprisingly, these have led to quite considerable effects on the mental, physical health of older people. So if this is the extent of the insights we have at the moment about what the COVID-19 crisis has done or how it has impacted the older population, and specifically dimensions of poverty amongst the older population. What sort of implications arise for both scientific and policy debates? I think this is a big question, and I struggled with trying to think about what exactly the implications are. I think a good place to start, which David also referred to, is to consider the wider post-COVID or COVID context within which Saharan Africa finds itself. The huge overall development losses that need to be halted, that need to be reversed, and the necessary reset, if you like, in systems that is needed to that end. And the imperative within that context to really identify those areas that are needed as a priority for investment to reduce poverty and inequality, given that resources are diminished everywhere. So it's really important to find where exactly governments and others need to invest to reduce poverty and inequality. And I think this points to a very urgent need for efforts to better understand the nature and the scope of older age poverty and inequalities. But what specific queries would one need to consider? And I sort of came up with 4, but this is just a very initial thinking, and I look forward to the debate on this. So I think the first question, how has the COVID crisis impacted? Have they deepened? Have they leveled? And what role have intergenerational dynamics played? And what role does age now play as an axis of multidimensional poverty inequality alongside other axes such as gender, spatial, ethnic, disability, or other? And how are these likely to evolve over the medium term? You know, there is an important temporal dimension here. What are the impacts we're seeing right now, and how are these going to evolve, you know, over the coming years? And then what implications arise for the continuity, the modification or expansion of old age focused social protection measures, care, or other policies? I don't have any good answers to those questions, but what I think is that on the one hand, they do present quite substantial conceptual and methodological challenges to try and address those questions through research. But at the same time, I think they offer a really important opportunity for concerted Africa-led research endeavor. And I would like to stop here and look forward very much to your questions and comments. Thank you very much. So I'll hand back to you, Lauren or Susie, I don't know.
Hi, Isabella, it's me. Thank you very much for that. I see that actually at the moment, it was really interesting to understand the context, the impact, and as you say, the kind of questions that we need to think about moving forward. And at the moment, there isn't anything, there's no open questions from our participants at the moment. I guess you also mentioned about the Great Reset, Isabella, and in a sense, and that you need this holistic kind of methodology to look at how the impact of COVID on the continent can be mitigated. I just wondered in terms of urgency, how do you see that kind of being framed currently for Africa as a whole or specific regions that you're working in?
Thanks, Susie. Well, I think there is a sense, and I should say that, you know, I am not privy to most of the important conversations around this reset. So, but my take or my sense of this is that there is a sense of an urgency to rethink the ways in which social and economic systems have been organized. And there is a greater readiness. There is a readiness for rethinking new paradigms about the way systems, for example, should be configured, and that are focused on older people, care systems, social protection systems, as far as as far as the older population is concerned. Of course, rethinking systems that have a bearing on the older population has to be seen within the broader context of rethinking all other systems. And here, this is where the difficulty arises. And here is where I think it's critical that we better understand how the situation, the circumstance, the poverty of older and measures to address that actually relate to the situation and the prospects of younger nations, given that the youthful population key focus in sub-Saharan Africa. That this has been a focus of debate or focus of scientific. What I do think is that, as I mentioned at the outset, there's a readiness to consider these issues. Maybe there wasn't so much of an openness. There is a sense now that we have to look at everything again and have an opportunity to reset things. And the last thing I would say is that my reading is that there is a sense too that to the extent possible and feasible, Africa should look to homegrown solutions. Homegrown solutions underpinned by perhaps a greater solidarity amongst and within African nations. A sense that the pandemic and its impact has shown the importance of Africa rely on its, that's possible. So, you know, this opens up more continental or regional debate about the reset rather than national specific debates. So I hope I've answered your question somehow.
No,
as I said, I'm not privy to the debates, but this is my reading of where we are.
Perfect. Thank you so much, Isabella. There has been a question also come up at the Q&A. I think we have one of our collaborators who's on Raphael's Zoom also would like to ask a question. If you won't mind, I will just ask Isabella Maggie Zen's question and then we can come to you. So Maggie Zen says, do you think the challenge is data when you mentioned that gender inequality is less clear on poverty on older population, or lack of research in this aspect? So you seem to be going out slightly for us in terms of the audio.
Is this better?
Yeah, that's.
Yeah, sorry. So I think the answer is both, Susie. So I think on the one hand, there hasn't been sufficient focused research to really understand the nature of inequalities and age inequalities and how they intersect with one another. There also hasn't been sufficient age disaggregation in some of the data that we do have around poverty. And you know, there are initiatives such as the Titchfield Group on aging data, which are trying to move towards a situation where surveys or other platforms is sufficiently age disaggregated so analysis can take place, among others, to illuminate questions like that.
Okay, thank you very much, Isabella. And we'll move on to, well, I'm sorry, but please do introduce yourself because I'm afraid you're on Raphael's Zoom channel. But
yeah, I know. I see. Mine is not a question. My name is Hassan Kaya.
Hi, Hassan.
From in South Africa here, Laban. I mean, I'm not asking a question, but I just wanted to make a kind of a contribution. I think there are two aspects here when it comes to age and poverty. There's a tendency looking at old age the way you conceptualize it in Europe, whereby you look at old age as a burden, either to the family or to society or something like that. I used to, when I was a student in Germany, I used to work in an old age home for almost 3 years as a student. People brought their mothers to old age home because they find them as a burden. So poverty becomes a solitary thing. And the older you become, even if you depend on social welfare, it becomes a problem. In Africa, it's different. And also, I'm not generalizing Africa as a continent, not a country. There are different cultural diversities, dimensions, and the way also people handle old age. Also, there's a difference between rural and urban areas, where in urban areas, because of limitations of income, whatever, it's different. But in most of Africa, being old is an asset. It is a kind of a celebration. And when there is poverty, it's not a solitary thing, as I said. It is shared by all members of the family. I can't be rich when my mother is poor. I can't eat when other people are hungry, or people who took care of me when I was nobody. So we need to look at also poverty and other global challenges within the context of old age in a kind of look at in terms of culture, in terms of geographical, ecological location, instead just of taking this just a single variable. I think I should stop there because of time.
Thank you for that comment, Hassan. Isabella, would you like to comment on that?
Yes, so thank you very much for that comment too from me. I think you raise a number of important points. I mean, one is the last point was, the last point actually pointed again to the importance of really embracing and incorporating in all analyses that we do the heterogeneity within the older population, because it's so vast, you know, cultural, geographical, and so on. The other point you raise about the cultural aspects or the value, I think, a value ascribed to older age within the continent. I know that the idea that Africans, that we respect our elders, that old age is seen as an asset, is a strong narrative, and it's almost part of our identity, an identity that we often juxtapose and contrast with what we perceive to be the case in the global north. And you know, your example from Germany just did that. But when you look at the evidence that we do have about the circumstances of old, and about the degree to which family care systems and family support systems are adequate, we find that there are profound gaps, not because older people are not respected necessarily, but because the capacities of families and younger generations to provide support are diminished in many circumstances through rural-urban distances and the physical distance, through poverty. And so there is I think it's important to be aware of this juxtaposition. On the one hand, the value ascribed to older age, on the other hand, the very real experiences, lived experiences of care and support, or the lack thereof, that evidence points to. And I think this is a really important area for debate, because it has huge implications for the kinds of policy responses that we then develop to ensure that you know, old age in the continent is not only valued, but remains a good old age. But thanks very much for that comment. It'd be good to continue the conversation.
Well, thanks very much to everybody who contributed a question or comment, and also to Isabella for her great presentation. I'd like to hand over back to Lauren